Horses are prone to injury because of their natural curiosity and their flight or fight response. Head injuries are a common injury when a horse either rears up and flips over backwards or has a fall or some kind of other injury. Head injuries are a common cause. There's several different signs of head injuries. If we start with a horse rearing up and flipping over, they usually hit their poll area, that bony prominence there, and that can lead to severe damage. The thing you need to remember with head injuries is that the horse can become very neurologic, there can be profuse bleeding, and above all else you need to remain calm and be able to tell your veterinarian the sequence of events when he or she arrives. Horse owners tend to overestimate the amount of blood that a horse can lose. Profuse bleeding from the nostrils is an emergency situation with a very poor prognosis. However, a 500-kilogram horse has 15 liters of blood running through his or her system. So you need to realize that a horse can lose 2.5 liters of blood without any compromise. If you do see profuse bleeding from a wound or an injury, you need to apply direct pressure to that injury until the bleeding is stopped or till the veterinarian has arrived. Deep puncture wounds can look a lot worse than can be a lot worse than they really look. In those cases, again, you need to call your veterinarian, as your horse may need a tetanus booster. Fractures to the skull are also serious problems. They can lead to fractures of the orbit, the bony orbit that contains the eye, leading to secondary eye problems. There are frontal sinuses in the horse that run from here to here, and maxillary sinuses. If a horse has a depression type of fracture or a trauma to this area, there can be damage into the sinuses. This will appear as crepitus under the skin. You can get air under the skin from sinuses as the air passes through the nasal passageways. Again, these fractures need immediate veterinary care, or they can lead to chronic sinusitis. Other injuries to the head may involve the premaxillary bone with the upper teeth, or the mandible, the lower jaw. Injuries to those bones cause difficulty in eating. The horse may have a horrible odor to his breath or a purulent nasal discharge. These signs may not be immediate, they may be a bit delayed.